arch, right? You see the aortic arch? How pretty it looks in here, huh? You see it? The aortic arch in cats is going to give me 2 branches. In human beings, it's going to give me how many branches?
3.
The first branch of the aortic arch is going to be the brachiocephalic artery. You see how big it is? It's big vessel. And then the second branch is going to be the
You guys are stepping on
left subclavian. Yeah, that's subclavian. Now the brachiocephalic is going to give me branches, right? It's going to go underneath the clavicle and it's going to be called
subclavian. Left subclavian.
Actually, the right subclavian. Right subclavian. And then it goes into the armpit and it's going to be called axillary. And then it goes into the arm and it's going to be called
brachial.
And the brachial gets me in the forearm. How many branches?
Radial.
Very good. Radial.
Now, is that all you're going to have in the test regards to the veins? Or you're going to get like, the mammillary and all that stuff like that, are you?
Well, the thing is that the mammillary and the vertebral in this cat, they got cut off. In the ones in the test, I'm going to see if we could find it or not. It all depends. Well, most likely you're going to know that for sure the big vessels are going to go. Now, the other branches of the brachiocephalic are going to be which one?
Say again?
The brachiocephalic gave me the right subclavian, right?
Right.
Yeah.
And it's also going to give me what other organs?
Left.
Internal memory.
No, stop playing.
Which one?
Brachiocephalic. Brachiocephalic gives me 3 branches. Right subclavian and then the... What are these? Carotid. Right? So this is going to be the right common carotid and this is going to be the
Left common carotid.
left carotid. Very good. Now, remember that the cat anatomy is slightly different in the upper body than in the human, right? Now, here we see which artery is this one. What is this one? This is, yeah, go ahead.
Left subclavian.
Left subclavian. You see it? It's coming right out of the aortic arch. You see it? Then the left subclavian is going to go underneath the clavicle and it's going to give me the...
Left sub.
The left subclavian, sorry. The left subclavian is going to go here into the armpit and it's going to give me the axillary and then the brachial. Very good. Now, the aorta, once it's in the in the chest, is called the
thoracic.
Once it passes the diaphragm, it's going to change name. What's it going to be called? Abdominal aorta. What's the name of the first branch? You can see it there. Let me put the. Can you see it there? Yes or no?
Yeah.
Hold on, let me put it.
Don't put on the cat juice.
Miss, you sticking stuff too hard.
The first branch of the abdominal aorta is going to be the celiac trunk. Very good, Manuel. The celiac trunk is going to give me 3 branches. One is going to go into the stomach that is called the
Gastric.
one is going to go into the spleen.
Splenic.
And then the hepatic. Very good. Then, the second branch of the abdominal aorta is going to be the superior mesenteric artery. And then it's going to find here in this little gland, it's going to be the adrenal lumbar, right?
Oh, I thought you was talking about the gland.
Then, it's going to give me this branch. It's going to the kidney. I'm going to call that the renal. You see how it's going towards the kidney? You have to follow it. Then one is going to go into the gonads, and it's going to be called gonadal. If it's a female, it's going to be called
ovarian.
And if it's a male, it's going to be called
spermatic.
Very good, spermatic. Now let's go on. Now here we encounter this one. What's the name of this one?
Inferior mesenteric.
Inferior mesenteric artery. Then these goes into the lower back, and they're going to be called iliolumbar. Very good. Then it comes to a point that the aorta, it branches out or bifurcates, right? Forms this V shape, right? What's the name of this? What's it called? What is this? External iliac. And then we're going to have the
internal
iliac. Once the external iliac passes the inguinal canal or the groin, it's going to change name. What's it going to be called now? Femoral. This is the femoral artery, right? We're going to have into the deep femoral. Then we're gonna follow it in through all the interior of the leg, and it's gonna be called the saphenous. Remember, this big artery gonna go all the way. Then it's gonna go deep behind the knee, and it's gonna be called popliteal. And then on top of the knee is gonna be called superior articular. Now, I'm also gonna ask you parts of the organs. Identify the organs of the cat, right? What is this shiny glossy appearance? What is this? Parietal peritoneum. What is this?
Kidney.
What is this organ?
Spleen.
Very good. What is the name of this mesentery?
Mesentery proper.
Mesentery proper. Okay. What's the name of this organ?
The liver.
Now, the liver in the cat has how many lobes?
5.
Which is this lobe?
Right.
Right one.
Right medial.
Right medial lobe, and then it houses the
Gallbladder.
Very good. Then if this is the right medial, then this must be the
Left
medial, and then it's going to be the
Left
left lateral. And then here we're going to encounter this one that is going to be the right one. Right lateral, and then the
caudate.
caudate. Very good. The caudate, like the tail, right? Caudate. Now, we also have this fatty tissue. What is this?
Greater omentum.
The greater omentum. You see how it covers the intestine like an apron, right? Greater omentum. You see it? I'm going to ask you all that, people. Pay attention. And then this must be the lesser omentum. Very good, very good. Now here we're going to encounter a ligament. What's the name of this ligament? Falciform ligament that is going to divide the liver in. Very good. Excellent done. Now, here I'm going to encounter a mesentery. What's the name of this mesentery?
Mesoduodenum.
Mesoduodenum. This we said is the mesentery what?
Proper.
You see? Mesentery proper. Are you paying attention, people? Pay attention. Because and then the mesocolon. Here is kind of ripped off because we ripped it off for the purpose of dissection. And then the mesorectum. Very good. Excellent. Now, this is the
Heart.
and then this is the
Liver. The lungs.
And then we said this is the windpipe that is called the trachea. Trachea, right? Very good. Okay, you can put away there.
Okay. Let me get the cat juice.